This is phase one of exercises that would be safe to perform at home and in gym class following your ACL reconstruction. We're going to begin with what we call a straight leg raise. First, we'll start with a straight leg raise on your back, or medically known as the supine position. The key to the straight leg raise before you start to engage any movement is to really engage the quadriceps muscle by pushing down. So push down, relax. Push down, relax. You can see the quad tighten. Through the whole movement, the quad should stay tight. And once the quad is tight, you should lift the whole leg straight to the height of the opposite knee, which is bent. Slowly up and then slowly return. When returning to the bottom, you should relax and then retighten your quad and repeat. For these exercises, the straight leg raises, sets of 3 sets of 8 to 12 would be appropriate. Next, we'll look at the second variety of straight leg raises. For all the straight leg raises, it'll be crucial to keep your quad tight and squeezed throughout the motion. This is a straight leg raise into abduction. For the abduction straight leg raise, the involved leg is facing the ceiling, and the non-involved leg is bent underneath. The idea here is to keep the hips forward with the leg back behind the body, and then at this juncture to tighten the quadriceps and lift the leg into the air. Doesn't need to be too high, a little ways up, and then return to the start position. Relax the quad, retighten, and lift. The target here is the gluteal muscles, specifically gluteus medius, as well as the quadriceps as you continue to tighten the quad. 3 sets of 8 to 12 is again appropriate. Now we'll look at a straight leg raise into extension. The subject now is laying on his stomach, and while you can't see it, is still going to tighten the quadricep muscle, the front muscle in the leg, prior to lifting his leg straight. So he'll tighten the quad muscle, and then lift the leg straight as high as he can without tilting his pelvis or his hips off of the mat. They should stay flat throughout, and then lower. The timing is about the same, up and down in about 3 seconds total, keeping the quad tight throughout. 3 sets of 8 to 12 again is appropriate for the straight leg raises. Now we'll take a look at a straight leg raise into adduction. This is perhaps the trickiest of the movements, but once you get the hang of it, you'll do just fine. First, what we're going to do is bend the non-involved leg over the top of the involved leg to create a window for the leg to move through. Here, the bottom leg, or the leg the subject is laying on, is the involved leg. The subject will again tighten the muscle in the quad, keep it tight, and lift the leg as high as they can, and then return to the starting position. Again, the key is to keep the quad tight throughout the motion, lifting up and down, slow and controlled, in 3 sets of 8 to 12 is again appropriate for this exercise. And this completes straight leg raises in 4 directions. It's important to keep the quad tight to assure the straight leg raise is legless and no bend occurs in the knee. Okay, now we're going to take a look at the strap knee bend to push straights. Exercises performed just how it sounds. Your therapist will provide you with a TheraBand to provide resistance for the exercise. The focus of this exercise is to both promote knee flexion or knee bending while trying to engage the quad or the top muscle on your thigh. So you're going to place the band around your back and then place the opposite end of the band around your foot. You may need a towel underneath your heel to make sliding easier. At this point, you're going to place both hands on the sides of the band and bend your knee as far as possible. When you get to the top, you're going to continue to pull on the band with your hands to create resistance and push out against the resistance, pushing your knee straight, flexing the quad muscle or the top muscle on your thigh. You perform this 3 sets of 10 repetitions. Next, we'll look at an exercise we call bolster hangs. The intention of this exercise is to help to get the knee straight following ACL reconstruction. To do this, the subject here will place his foot on an object with the heel propped, toe pointing towards the ceiling. Oftentimes, the tendency is to let the toe turn outwards and down, which will defeat the purpose of the stretch. Keeping the toe pointed upwards towards the ceiling, the subject will let the knee hang and become straight by letting gravity pull downwards. This should be done 3 times with a minute hold. The stretch should be felt in the back of the knee. In later stages, you may be able to add weight to the top of the knee to increase the stretch you feel. But to start out with, just start with your foot propped with the heel on an object, letting the leg hang and gravity pull the knee straight. Next, we'll take a look at some muscles that are important to stretch in phase 1 of the ACL reconstruction rehab. First, we'll look at the hamstring muscle, which is the muscle in the back aspect of the thigh. To stretch the hamstring muscle, at home you'll likely use stairs, placing the heel of the involved leg on the step, hanging on for balance if need be, and then leaning gently forward till you feel a pull through the back of the leg. Stretching should not be painful in this case, but you should feel a nice stretch in the posterior aspect or back aspect of the thigh. This stretch should be held 3 times for a 1-minute hold. Next, we'll look at stretching a calf muscle, in specific the gastrocnemius, which is a calf muscle that crosses the knee. To perform this stretch, you'll need a wall. The hands will be placed on the wall. The involved leg will be the back leg, and you'll come into almost a stride position. With the involved leg, the back leg, you'll allow the front knee to bend slightly and then shift your weight forward onto the front leg while keeping the back leg straight. This will create a stretch in the upper calf. This stretch again should be held 3 times for a 1-minute hold. The second of the calf stretches, it's targeted at stretching a muscle lower in the calf that doesn't necessarily cross the knee, but is still crucial to stretch in phase 1 of ACL reconstruction rehab. You'll assume a similar position as previous, with the involved leg the back leg, the non-involved leg the front leg. This time, your stance will be narrower, and you'll allow both knees to bend. Allowing both knees to bend will cause the stretch to come lower down towards your heel. This will provide a stretch in this region and should be performed 3 times for a 1-minute hold. Next, we'll take a look at stretching the quadriceps muscle, or the muscle in the front aspect of the thigh. To perform the first stretch, you'll lay on your stomach and bend the involved knee. If you can reach your hand back on the same side and grab the front aspect of the foot, pulling the heel towards your rear end. By doing this, you'll create a stretch in the front aspect of the thigh. This is a stretch for the quadricep muscle, and pain should not be felt in the knee or about the kneecap, but rather in the thigh muscle itself. If you do feel pain in the knee, you should consult your therapist before continuing to perform this stretch. If you cannot reach your hand back to grab your foot, you may place a belt or a strap around the foot with a rope or a towel and use that to have leverage to pull your foot towards your rear end. This stretch should be performed 3 times for a 1-minute hold. Another stretch for the quadriceps muscle, the front muscle in the thigh, can be performed in standing. You'll want to be able to balance yourself, as it's very difficult to stretch a muscle that's also working to maintain balance. As so, you can place your hand on a wall or anything else that may help you balance. Then you're going to bend the involved knee and grab with your hand, pulling your heel towards your rear end. Oftentimes, in layman's terms, this may be called the flamingo stretch in your sports activities. The idea is to pull the heel towards the rear end to create a stretch in the front aspect of the thigh. Again, no pain should be felt in the knee, but rather a stretch in the thigh. If you do have pain, consult your therapist before continuing. This stretch should be performed 3 times for a 1-minute hold. Next, we'll look at an exercise for the core musculature. While you obviously did not have surgery on any of your core musculature, the core is key to creating a strong base to allow for stable knee movements to happen during later phases of rehab. To begin, we'll look at a low plank. For the low plank, the subject will come down onto his elbows as well as his toes and lift the remainder of his body into the air. He will keep his back and rear end flat, which is good form. As you tire, you may come into a V, which is bad form. If you come into this bad form, take a break and then resume the plank when you've recovered. In total, you should perform 3 rounds of a minute hold. If you can go the whole minute, this will be 3 rounds of 1 minute planks. If you cannot, stop the clock every time you come down and restart when you come back up.